So as part of your anatomy tutorial, we want you to understand the different planes of movement that we can take our bodies and our joints into. And the first plane we're going to talk about is the sagittal plane. So if you can imagine a pane of glass or maybe a sheet of paper that's coming straight through the front of me, it goes through the middle and it's going to stick out the back and it's going to cut me into right and left portions. If it's directly in the center of my body, it's sometimes called the mid-sagittal plane, but it could be slightly off to the side as well. So, in your mind's eye, imagine that sheet of glass. If I was to move from here in that plane, it would look like this. It would look like this. Perhaps I'm moving through the spine, because remember I can do this at different joints. I could even do it at the hip as well. And that is called flexion and extension. All right, so flexion and extension always happen in the sagittal plane. We should also kind of indicate which joint we're specifically talking about. So this would be shoulder flexion, shoulder extension. This would be elbow flexion, elbow extension. This would be flexion at the hip. And this would be extension at the hip. This would be flexion at the knee, extension at the knee, and then we've got our spine, which we can flex and extend. All right, so basically flexion is when we are bringing two bones closer towards each other, and extension is when we're taking two bones further away from each other. And you probably recognized a lot of those movements from yoga, Pilates, maybe other disciplines that you do as well. If I was lying on my back and I was doing a classic chest lift or a sit-up, it would look like this, and that is flexion of the spine. Or if I was to flip over and lie on my stomach, and then I lifted my head and lifted my chest, we would be doing the cobra. Or if you went up a little bit higher in yoga, that is called your upward facing dog. That would be extension of the spine. So those happen in the sagittal plane. We could also look at what's happening at the hip. So another classic yoga posture would be your downward facing dog. So if I went into downward facing dog here, I would be at flexion of the hip. So start applying that knowledge to the movements that you're doing in your course, in your classes, and see if you can start to identify when you are moving forwards and backwards, flexion and extension in the sagittal plane.